you'll be able to hear them as well. Is everyone good to go at the back there? Perfect. Premier Moe?
Well, thank you very much, everyone, for being here today, and thank you for those that are tuning in and watching. And I want to start with a huge thank you to the people of Saskatchewan. Thank you for taking the COVID-19 pandemic, taking this so very seriously. You are doing exactly what you were supposed to do, and so for that, we are very appreciative. Thank you to everyone who is providing an essential service in this province. Thank you to the doctors, the nurses, and all of the other health professionals, the people in the labs that are doing tests, and thank you to the pharmacists, to the police, thank you to the staff in our grocery stores, and all of the other people who we are asking to continue working because we need you to, and we need the services that you provide. Thank you as well to everyone that is staying home, knowing that you are also doing your part. It may not feel like you are doing your part, but most assuredly you are. You might be thinking, I feel like I should be out doing something to help. Well, by staying home, you are doing something to help. You are keeping yourself safe, you are keeping your family safe, and you are keeping many others safe. You are keeping all of the people in our province safe. So thank you so very much. So this will end. Life will get back to normal. We don't know yet when that will be, and at this point we are still focused on doing everything that we can to limit the spread of COVID-19. Today, Saskatchewan's Chief Medical Health Officer has confirmed 14 new cases of COVID-19. The provincial total now is 66 confirmed or presumptive cases of COVID-19. As well, a number of previously announced measures came into effect today. These include the closure of restaurants, food courts, cafeterias, cafes, bistros, and similar facilities with the exception of takeout and delivery. The closure of all recreational facilities and entertainment facilities, personal service facilities, the closure of dental offices, and caps on our daycare facilities. And we're also providing immediate action on the supports that were also announced last week for employers and for employees. The Government of Saskatchewan has launched a business response team to support businesses in the province that are dealing with the economic challenges resulting from the restrictions of COVID-19. The business response team, led by the Ministry of Trade and Export Development, will work with the businesses to identify program supports that may be available to them both provincially as well as federally. An email address and a toll-free telephone number have been created to provide businesses one single point of contact to help answer questions. Businesses can contact the business response team by calling 1-844-800-8688 or emailing supportforbusiness@gov.sk.ca or by visiting saskatchewan.ca/COVID-19-businesses. We have been contacted by many businesses, many individuals and groups who have been offering ideas and really innovative ideas and solutions that may help us address this pandemic. Some Saskatchewan manufacturers and suppliers are also coming forward with further innovative ideas on how they can produce equipment and supplies in their facilities. And if you are a Saskatchewan business, an innovator, or a supplier, and you think that you have a solution that can help us in this battle against COVID-19, you may direct your correspondence to procurement@gov.sk.ca. That's procurement@gov.sk.ca. A website has also been launched to provide information on support for workers who have had their employment impacted by the current economic situation. Workers can visit saskatchewan.ca/COVID-19-workers for more information. After this press conference, I will be participating in a conference call with all of Canada's premiers and the Prime Minister of our nation. And I cannot stress enough the importance of continued collaboration between all of the provinces and the federal government as we tackle this COVID-19 pandemic together. We are already seeing some of the direct benefits of this collaboration. For the past week, I have been in communication with Prime Minister Trudeau and Deputy Prime Minister Chrystia Freeland regarding the cutting-edge work that is occurring at the University of Saskatchewan at the Vaccine and Infectious Disease Organization, or the VITO Intervac. And VITO Intervac is the first lab in the country to have a vaccine candidate that they are currently testing. This vaccine was made in February, and researchers expect to know in about 4 weeks whether that vaccine works in animal models. So today, the Prime Minister announced $23 million in further support for VITO Intervac, a critical investment in research that was occurring right here in Saskatchewan, and that will support that research and allow the lab to expand its biomanufacturing capacity to support clinical trials. And I do want to say a thank you to Grand Chief Perry Bellegarde, who is also advocating on VITO Intervac in Saskatchewan and Canada's behalf. This is great news, and I want to thank the federal government and the Prime Minister for this critical investment. I will be continuing on in today's call with the First Ministers in this very spirit of collaboration, and will raise how important an aligned and unified message across this country is regarding the enforcement of restrictions in province after province. As I said on Friday, the overwhelming majority of Saskatchewan residents and Canadian residents are following these restrictions, and they're following them closely. But there are a few that aren't. So I was pleased to hear the Prime Minister deliver a strong message this morning when he said, and I quote, "Enough is enough." The fact of the matter is that all Canadians must follow these restrictions, the restrictions that have been put in place by each respective province. So thank you, and I'll now turn it over to Dr. Shahab, our Chief Medical Health Officer.
Thank you, Premier. So, as the Premier said, we have had some increase in confirmed cases. Almost all are travel-related, and investigations are ongoing. 5,269 tests have been performed. So the testing capacity continues to keep pace with the need for testing where appropriate. 61% of the cases are males, 39% are females, and 2 of the cases are individuals 5 to 19. All others are adults, and we'll be providing, like I promised, we don't have that table ready today, but we will be providing in a day or two more demographic information. I think, like the Premier said, we are at a critical point now because most of our cases are still either travel-related or related to large events. Large events now are no longer happening in Saskatchewan. We have cautioned against going to any large event anywhere else in the province, in the country. We have cautioned against any unnecessary international travel after the order on the 16th, because it's really important if you come back to stay on home isolation strictly for 2 weeks, but it's also important now to not travel and not keep, because otherwise the cycle will continue. So at this point, we have seen and heard from throughout Saskatchewan how people are very responsibly practicing staying home on self-isolation if they have traveled back or they are a contact of a case, and practicing in a very thoughtful way that physical distancing, so maintaining that social connectedness, but practicing that physical distancing in a very thoughtful way. And I think if we can sustain this, we can keep our curve flat, but it has to be sustained, and we will have to do a check-in at 2 weeks, for example, to see how things are going. But I think this is a critical point for us because we still do not have any evidence of community transmission, and we need to see for how long can we sustain this absence of community transmission, so through all the things that all of us are doing collectively.
Thank you. Arthur?
Last week, when the first case was announced that couldn't be definitively connected to travel, you said that you would reassess days later to see whether it could be connected, and if it couldn't, it would be time to declare that there may be community transmission. Could you expand on how that investigation went and why you're still confident that there's no evidence of community transmission?
That's right. So sometimes it does take more than 2 or 3 days. So last Thursday, we had 3 out of all the cases who were tested positive. We had 3 situations where the investigations were not complete. Those have been completed. But the investigations for cases that were tested positive on Sunday, for example, are still continuing. But this is something that we are watching very closely, and it does take more than 1 or 2 days sometimes to tie all the threads together. Obviously, most of the cases have a clear travel history, and it's very easy. A lot of people actually right now are coming from the U.S., so it's very easy to get that history. In some cases, it may be travel or contact with another person who had traveled, so you are a close contact of a case who had traveled. That takes a bit of time. And finally, last week we did have people who had gone to other large events in different parts of the country. That's also something we are recommending, that not all provinces may have the same restrictions on large events that we have, but that doesn't mean you should go to a large event in another province that does not have the same restrictions.
So just one sort of quick kind of clarification there, and then one follow-up question. First off, does that mean that all the cases up to Saturday then have been definitively connected in a chain back to travel outside of the province, and it's only those from Sunday on where you're still doing investigation?
That is my understanding, except one where we're still seeking some further investigation.
From prior to Sunday.
Yeah.
And the follow-up, we're hearing some reports that there may be a patient intubated at Pasqua Hospital. Can you confirm whether that's the case? And further, just say more broadly whether any of the patients have been hospitalized.
So I do not have that detailed information. I was aware that 2 persons had been hospitalized due to, were COVID-19 positive, but they were hospitalized due to other situations. But we will get that information, and we should be able to actually provide that as regular updates. It may not be daily, but at least twice a week we should be able to provide updates on both persons hospitalized, persons at home. And we have to say we are now at the point where some of our initial cases are going to be screened, and if they're well, they'll be reported as recovered. So we will be getting that information as well towards the end of this week.
Steph?
You say this is a critical point for physical distancing, social distancing. Why are you not then dropping the crowd size limit to 5 people or under, as has been called for by the mayor of this city and other leaders across the province, as we've seen other jurisdictions drop their limits to much fewer than 25? Why aren't we seeing that happen here?
So I'll give you my own view, and I mean, I think this really depends on what setting we're thinking of. Like here we have maybe, 10, 12 people. So as long as we can maintain a 2-meter separation, we are more than 5. I wouldn't go into an elevator with 5 people, for example, because you can't keep that 2-meter separation. And I think we have to apply the context. But I agree that I think, I've said this many times, that I think now is actually not the time. I was saying last week or week before last that I will not go to someone's house if it's more than 4 people in a room, where you can't really do it. Right now, I'm encouraging that we don't even visit in person. We stay in touch. We can wave to each other as we are on walks. But I think this is the time to really be disciplined about that, because we really want to calm things down to prevent any risk as much as we can of community transmission, because that would be the return of all this effort.
So maybe just on if I could add just on the 25 to 5, and maybe even just a little bit deeper on the motions, a few motions that have been passed, not only by the city of Regina, but there's another municipality or 2 as well that have been passing emergency motions. And what we have done as a province is try to provide that clarity and a clear alignment, at least within the province. One of the conversations that we're going to have in just a few minutes here with all of the premiers, and the Prime Minister, is is there further opportunities for us to align some of the restrictions that we have put in place in our provinces across Canada. Now, you've seen in many cases premiers moving at different rates, if you will, depending on advice from their chief medical health officers, depending on the rate of COVID-19 infection in their communities. And I think there is an opportunity for us to work more closely, if you will, with the federal government on aligning those restrictions across Canada so that it's clear for all Canadians. And to have a patchwork among 5, 10, 20, 30 municipalities, rural and urban, in the province of Saskatchewan doesn't doesn't advance that interest of providing that clear alignment of restrictions and regulations across the nation. And why is that important, you may ask, is one, it's very clear to all Canadians, wherever you are in this nation. Two, when we get to the other side of this pandemic and we start coming down on the curve and these restrictions start to be lifted, I think it's just as important that they are lifted with the same type of eye to alignment across the nation and trying to be as clear as possible so that people aren't lifting them in one province and not another province, lifting them in one community and not another community. And so what we're trying to do is to provide that clarity, at least for all of the people in Saskatchewan, and collaboratively trying to provide it for all Canadians as well.
One follow-up is, what specific asks are you bringing to the Prime Minister as you are set to speak with him, and maybe you've spoken to him this morning already? Like, what specifically have you asked him?
Well, we've been working with him very closely on the Vito Intervac investment over the course of the last number of days. The specific asks that we will have some on the economic side, some with respect to some details around some of the orphan well program, for example. But our specific ask, and I suspect many premiers, I won't speak for other premiers, but will be around just that, aligning our restrictions across this nation. And is there an opportunity for the federal government to be involved in that alignment of like we had just said, for example, the essential services that are being provided in our communities. And if, one of the motions that was put forward, not just by the City of Regina, but we see Ontario and Quebec going there today as well, is if you're not providing an essential service, then you won't be going to work. We're asking you to stay home for a period of time to put a stop to the spread of what I can only assume is community transmission in those communities. So that is some of the work that we will be working on here today. Is there an opportunity through our federal government, with our federal government and all of the premiers on the phone, to align our restrictions and provide that clarity for all Canadians?
We're going to take a question from the phone lines. Operator, do we have a question on the lines?
We have Allison Sandstrom with PA Now.
Is there a question on the lines?
There, Allison. PA isn't that far away.
All right,
Hello?
It's Arthur's hometown.
Hello?
Yes.
Oh, hi, sorry, I wasn't sure if I was still on mute. Okay, I'd like to ask, we've seen a third case in the north now. Is that case also in South End like the other two?
My understanding is no, but I don't have that specific information. And I think we will be unable to confirm specific communities, but we can certainly speak to clusters that are linked to one another. So I will get that information.
Adriana,
Do you have any other?
go ahead.
Okay, so two kind of related questions. There's a lot of anxiety around the difference between self-isolation and social distancing. So, is it safe to go for a walk versus lock your doors and stay inside? Now, clearly, and also in terms of a walk, like right outside the door, we have Wascana Park. There are a lot of families walking around out there. Is that safe if they're within 2 meters? And then my sort of linked question to that anxiety is there any consideration for more dedicated mental health support for people who are, I've heard reports of even saying they feel shortness of breath because they feel anxiety right now. So the first one's to you, second one, I guess, to both of you.
Thanks. So these are unusual times, and I think we need to balance the need for physical distancing with the need for human contact within the household. Obviously, lots of good ideas available about how to engage with children, how to take advantage of the slow time in our lives. But also outside with friends and neighbors, that if we have no restrictions, we haven't traveled, we're not in contact of a case, you should in fact go out for walks, and you can walk closely with your household members because you're together anyways. But obviously keep that physical distance with friends, neighbors who you meet, and away from 6 feet distance, and in that way there is no risk. Similarly, for people who are unwell and isolating at home, they obviously need to have the highest level of precaution, stay in their room, don't share towels or other materials for having food and so forth. Meticulous attention to hand hygiene. Other people in the house who are not close contacts can self-monitor and go out. If someone was a close contact of a case, who had long contact, more than 15 minutes within 1 meter, which can be many people in the household, they are also asked to, stay at home. But as long as they're asymptomatic, they can go to their backyard. If they live in a rural area, they can obviously go on a solitary walk. It's challenging if you live in an apartment building where you may have to go down an elevator, downstairs. It is very challenging, but we suggest that you minimize any going outdoors if you are a close contact or returning traveler in that setting. But in a setting where it is possible to take a solitary walk as a return traveler, you may.
I will maybe just add on the second question, and we have Derek Miller and Susan Shaw, I believe, on the phone as well with the Saskatchewan Health Authority, and they may have something to add just at the end on the entry points into the healthcare system for those that are struggling with anxiety, if you will, and feel that they need to have some treatment for that. But we continue to invest in mental health services here in this province. I mean, very large investment last year, another investment in this year's spending intentions, and that investment most certainly will be there. It was going to be there regardless of a COVID-19 pandemic, but it most certainly, I think, is important that it is there now to provide those services. With respect to social distancing, and not self-isolation, but social distancing, and going outside and trying to keep some degree of normalcy in our everyday lives. I would encourage people to do that. Just use good old-fashioned Saskatchewan common sense in ensuring that you are staying away from people, and if people do stop to talk, make sure you are keeping that separation. It's important not only for you and for them, but for both your families and ultimately your community. An example in point is my wife took me out this weekend cross-country skiing, and I wasn't able to keep up with her, so we had a lot of social distance. But we did see other folks out there where you were just careful to, and some of them physicians as well. We were careful to keep, a few meters between one another. There's no reason to be standing, that closely. And so everyone that I had the opportunity to bump into this weekend very much was, very aware and practicing the social distancing that was there. But they were also outside enjoying the beautiful environment we have in this province.
On the anxiety, though, I believe I saw some consideration from Manitoba launching like a support line specific to this anxiety around this. Like,
right.
Is there anything about that or online options?
Derek or Susan, would you speak at all to the entry points that we have now in to our health treatment, if you will, from an anxiety or a mental health perspective?
So this is Susan Shaw, and I'm speaking in Saskatoon. I think it's so important that we all, while we're taking care of ourselves, we think about the full part of care. So self-isolating, excellent hand hygiene, and taking all the necessary measures, but also reaching out and keeping an eye on one another to support one another spiritually and emotionally, and taking care of our mental health as well. We have many points of entry within the province for those who do need someone to speak to, whether it be beyond their family or their church or their usual support network, and Health Authority is here for you. The first place I would recommend is through your family physician or your nurse practitioner, and there's also mental health hotlines across the province and supports that way.
Karen?
I'm wondering if we're seeing more cases in rural Saskatchewan now. Initially, they were sort of concentrated in Regina and Saskatoon.
So we have updated a number of cases, North, Central, South, Regina, and Saskatoon. They're proportionate to populations. Obviously, most of the cases still are returning travelers, and people are returning primarily from the U.S. to all parts of Saskatchewan, so that is to be expected. But beyond that, no variation that would be of concern at this point.
We're going to go back to the phone line for a question. Operator, is the question on the lines?
We have Devin Tassa with the Humboldt Journal.
Hi there, can you hear me?
Yes, we can.
You can hear me? Okay. So yeah, we had a confirmed case here in Humboldt, and what we've been told is that this person did not travel, and this person is sort of in a public role. So how concerned, if it is at all, is the province about the possibility of community spread in Humboldt?
I think community transmission, not just in Humboldt, but across the province, is something that we have openly said will happen and will occur at some point in time. And I think it's important for us all to remember that this virus is out. We are going to be exposed to it over the next number of months. Each and every one of us is quite likely going to be exposed to this virus. What we are trying to do in flattening the curve, in slowing the spread, is to not have everyone be exposed to it at the same time, so that we can manage the health services that we have to address those that will ultimately, and it's a small percentage, but collectively it can be a large number of people, so that we can manage the number that will need health services here in the province. So the fact that community transmission may or will happen, I don't think has been anything that is unexpected. But what we are trying to do is to manage the rate of infection, if you will, across the province, so that our health system can manage, provide the services that will be required. This has been the whole goal in flattening the curve, and Dr. Shahab has spoken on numerous occasions that if we are not able to flatten the curve, there's no health system in the world that would be able to actually provide the services that would be required if COVID-19 is able to run rampant, and we're seeing that in some other areas of the world. So I feel we're off to a reasonable start here in Canada, and in particular in Saskatchewan. But in the days ahead, we will likely need to go farther and work with our provincial municipal partners, our community partners, to do that. Anything else on that, Dr. Shahab?
One thing I would say is that on the one hand, I don't have the details and can't speak to specific cases. There's 2 points about that, like the Premier said. One is that public health does do a detailed investigation about all the close contacts, who are then informed to either self-isolate, or if they're close contacts, or self-monitor if they're not close contacts. And that's one way of breaking the chain of transmission. But the second thing that's really important is that if we continue doing what we're doing right now, social distancing all the time, that will also break the chain of transmission, even if we did have a travel-related case or a community-related case. So that it is essential. We talked about a critical juncture. It is essential we continue doing this for the next little while to make sure that we maintain our curve as flat as possible, and then reevaluate that. Is this what we need to do? Do we need to do more or less? But I think at this point we need to continue doing what we're all doing.
Arthur?
Over the past week or so, it seems like you've been providing extremely cursory information about demographics on these new cases. And I know that you said that it can take time to gather that information, but even when it does come out, it's not coming out on an individual level anymore. And surely it's possible to release some of that information without compromising privacy. I've heard from people that they would feel more comfortable if they knew whether or not there were cases in their specific communities. And I'm just wondering why you're not able to do that.
So the challenge with that, of course, is that it can potentially identify an individual. And I think we will have to take this back and consider, generally we don't disclose a community location. And the other thing we have to remember is that as cases continue to come, we will have cases who have come back from travel throughout Saskatchewan, through many communities. We may get community transmission, which may pop up in any community It may have linkages within the community or through travel to other places. So I think on the one hand, we don't want to compromise confidentiality as much as we can. And on the other hand, we don't want to give this impression that then it's just a risk in that community and everyone else needs to not take all the precautions that they need to take. But I think that's really important. While we think we have a really good system where everyone who comes back stays at home for 2 weeks, calls if they're symptomatic, gets tested, we do know that sometimes symptoms can be very mild. So as long as people stay home for 2 weeks, there's less chance of transmission, even if symptoms are mild and someone doesn't feel sick enough to get tested. So I think those simple principles applied everywhere through the province are essential. And we have to be careful that even if we were to disclose a location, if someone has isolated for 2 weeks, there's no risk actually, irrespective of where a person is. And if someone has not, public health is doing that detailed investigation to notify people who were close contacts.
And just to follow up for the Premier, based on some of Steph's questions, do you see any need for greater federal coordination? And is that something that you'll be pushing for in your conversation today? I'm thinking notably of the possibility of a declaration of a federal state of emergency, the potential of interprovincial border closures, and related, do you think that as provinces coordinate, that would result in stronger measures here in Saskatchewan, simply because some provinces are more advanced in the curve right now?
At times. I'll go in reverse on them. Well, first of all, with respect to our call here very shortly, I'm sure, I don't know whether the federal state of emergency will be a topic on that call. I would expect that it could be. But for certain, there may be some opportunities for us to work closely with our federal government to align some of the restrictions and, in fairness, some of the resources that are being offered as well. And we did that last week, trying to dovetail in on some of the federal resource package that they had put forward to, if you could, fill a gap here and there and enhance some of the opportunities for Saskatchewan employers and employees. So there may be that opportunity. There will be that opportunity to have that discussion here today, and I think providing clarity for all of the people of Canada where we can, maybe not in every case, but where we can, I think would be very helpful, and also helpful, if you would, in addressing some of the anxiety that people are feeling because there is this great unknown that we all have as to what is going to happen, and what are the rules that we're operating under. Can we go out for a walk if we're social distancing versus self-isolation? What can we do? What can we not do? So the clearer and the more clarity that we can provide across this nation, I think, would be beneficial for everyone on many levels. In some instances, I think if we were aligning with other provinces very closely, you would see some of the initiatives in Saskatchewan come a day or two earlier. In other cases, I think you would see them come a few days later, as we were the first to move on actually using our state of emergency, if you will, to ensure that it is the law of the province that people do self-isolate when they return from international travel. We've seen others starting to look at this now, but with respect to Steph's question around 25-person gatherings versus 5-person gatherings, that's something that we're actively discussing at the moment, as well as a number of other restrictions and some other resources that we may be able to provide, quite frankly. All options are being discussed by Cabinet today and tomorrow, and will be into the days ahead, as how we can best support Saskatchewan people and provide safe communities here. So there is cases where we might move a day or two earlier. There's other cases where we might move a day or two later.
And as for interprovincial border restrictions, is that something that you foresee being discussed on this call, and it's something that you would advocate for?
It's something that's been advocated for with me by Chief Bobby Cameron and a few others. We see some other provinces starting to look at this. I'm not sure exactly how that would get policed. It might be a little bit challenging to police between the provinces, given all of the border connections. Prince Edward Island might be a little easier with one bridge versus Saskatchewan, that has many connections from north to south on both our eastern and western borders. So that likely will come up on this call as well. What we have chosen to do, and I know what other provinces have chosen to do, and I hope that all Canadians, and this is a place where this is an opportunity and maybe an example of how all premiers and the Prime Minister could speak very loudly so that, and clearly so that all Canadians would hear is, if you don't absolutely have to travel, you shouldn't be. You shouldn't be crossing the interprovincial borders. You should be staying at home where you can. If you're not providing an essential service in your community, and your place of work is not actively working today, you should be considering staying at home, practicing social distancing, and spending some time with your family if that's the opportunity. So I don't know how you would police interprovincial travel like we have put into law the international travel, but I think it should be a very strong recommendation, and it is from this province, and I know it is from other provinces, but that might be an example of something collectively we could come out of this call on and saying, as all Canadians, you should stay put where you can.
Steph?
Mr. Premier, what should people do if they are still having to go to work because for whatever reason their workplace remains open and they are being put in situations they themselves don't consider safe? So maybe there's not enough social distancing, they're still required to travel for work. What should an employee in that kind of situation do?
Well, it's my true hope that all businesses are doing everything they can to provide the opportunity for social distancing, and I think it's incumbent on each of us as individuals to have that discussion not only at work but in your daily lives as to what is an appropriate distance for us to be apart and be open to bringing that up in our conversations. But I hope all employers at this point in time, and this is again an example of how additional clarity will help, if you will, in providing the difference between self-isolation and social distancing. What is an appropriate distance for us to be apart? And I hope all employers are not only encouraging that, but really putting their best foot forward, if you will, by ensuring that their employees are practicing social distancing. Listen, as we go into the days ahead as well, and I think this is important, and maybe some of it will come from the phone call that we'll have with all of the premiers and the Prime Minister, there quite likely is further restrictions coming. There quite likely is further action that will be necessary. We'll leave that to the recommendation of the Chief Medical Health Officer here in Saskatchewan and his colleagues across the nation. But we are seeing the infection rates increase, not decrease. That means that our work is not yet finished. We feel that we have addressed some of the largest challenges, if you will, in the days ahead in a number of people returning from international travel, as we have a cold winter here. But there's a number of people who are returning from international travel. We've put very strong mechanisms in place to ensure that they are self-isolating. And if required, and on the advice of our Chief Medical Health Officer, if we need to look very seriously around essential services being offered, and nothing else, well, then that's a bridge we'll cross when we get to it.
Are you concerned about, or how concerned are you about civil liberties being lost or jeopardized as we anticipate kind of further restrictions, and even the federal health minister has indicated that's maybe a potentiality? How concerned are you?
I'm concerned about a number of things, not only our civil liberties, as we move through trying to manage a pandemic that, as I've always said, really shouldn't affect in a large way, by the statistics, someone of my age, but it would affect the generation older than me in a much different way. So I am concerned with respect to some of the efforts that we are making and how that impact will have on civil liberties. I'm also concerned how the decisions that we're making today and the impact they're going to have on the general state of the economy, and what that starting point is going to look like when we get on the backside of this curve, and what opportunity we're all going to have as people that are employed in this province, the opportunity that we're going to have to go back to a place of employment when we find our way through this pandemic. So, our first and foremost priority right now is providing the opportunity for us to flatten the curve so that our healthcare system in this province can manage what we know is coming at it in the weeks and quite likely month or two at least ahead of us. Secondary to that, not secondary to that, alongside of that, we're trying to balance that with, respecting individual civil liberties, people's civil liberties, as well as those of society, but also trying to balance that with the impact that we're having on the economy.
We're going to go to a question from the phone lines. Operators, that a question on the line?
We have Chris Vandenbrekel with 650 CQAM.
Hi there, can everybody hear me?
We got you, Chris.
All right, perfect. I wanted to ask, and I'm not sure who can best answer this question, either Dr. Shahab or Dr. Shah perhaps, but how many beds do we need to free up in Saskatchewan to prepare for a potential surge of coronavirus patients, and how many have we been able to free up and prepare so far?
Dr. Shaw?
I think Dr. Shaw or Derek Miller on the line would be best.
So Susan Shaw, Chief Medical Officer with the SHA, and Derek Miller, Incident Command Chief. So we are constantly looking at how many beds we have and how many beds are available and how many beds we need. At this point, we have, as Dr. Shahab said, no admissions identified within our hospitals that are secondary to or caused directly by COVID. We are anticipating and preparing that we will need to be able to both meet the current needs and future needs, and plans are in place for that. We have equipment ordered, we have staff being prepared, and we are ready.
Operator, we'll take one more question from the phone line.
We have Laura Woodward with CTV Regina.
Sorry, Canadian Standoff. This is Laura with CTV News. I'm wondering if you guys have any specialized COVID-19 units at hospitals right now.
Units?
Derek Miller, specialized units.
I think Derek Miller can speak to that.
Yeah, hello, it's Derek Miller, the Incident Commander for the Emergency Operations Center with the SHA. So currently we aren't specifically assigning units as COVID units. However, locally within facilities there are plans being made to certainly support that, and that will be an essential piece of our surge capacity development going forward.
Got time for a few more questions. I've got Karen here.
You asked mine, so.
Okay. I think Wayne, you had a question?
Yeah, just, if it's okay, just to change the topic for 1 minute. Have you had a chance to look at the mediators report of the co-op strike, co-op lockout situation? And there are some calls today from the union and the opposition to call the House back.
Oh, okay. Yeah, and, briefly, I have had an opportunity to look at some of the recommendations that came from the report. Mr. Reddy, we thank him for his work. He's, one of the most sought-after mediators in the country, and we're very happy that he was able to come and do the work that he did and come forward with the recommendations that I understand have went back to both Unifor as well as FCL, and my understanding is that Unifor is accepting of the report, and I believe maybe voting on it today, and FCL is less so. So it would be our hope that over the course of the next short while that both of those entities will continue to work together in this what is a private labor dispute to ensure that they are have exhausted every option, if you will, with respect to coming to an agreement and coming to some degree of labor peace here in the provinces, as we as well are entertaining what options are available to the government.
We've got time for one more question on the line.
We have Guy Quinville with CBC.
Thank you. I wanted to return to the topic. Oh, can everyone hear me okay? Just for
Yep.
I wanted to return to the topic of hospitalizations. As of the latest information about this from Saturday, 2 cases are in hospital, but it was due to pre-existing illnesses. I want to bring us up to speed on that, however, though, or want you to. Are any of the in-hospital patients, have any of their cases escalated in recent days such that they are now in ICU? Or do we still not have any cases in ICU? I just want to get a better sense of where our hospital cases are at, including whether we have any cases now in ICU, even if they are those who had pre-existing illnesses.
Dr. Shah here, and I don't have that information, and if I had that information, it would not be appropriate to share it because of the importance of protecting our patients' personal health information.
We've got one more question from the room here, Adriana.
Again, so this probably would be directed to Derek Miller or Dr. Shah. Just to follow up, you didn't exactly answer how many beds will be needed or that you're preparing for or have ordered at this point. You said the plans are in place, but how many beds?
Hello, it's Derek Miller here. I will say that is I guess, the question that we all want to know in terms of trying to predict what a forecasted demand might be. We are working with the epidemiologists to forecast what we may be seeing in the future, and we're orienting all of our planning towards that. So we don't have a firm number to share in terms of the number of beds will be required, but that is something that we're certainly focusing on with our planning right now. And in terms of physical beds, certainly ordering of equipment like beds and others pieces of equipment will definitely be driven by what that additional capacity will be.
And it's so important to emphasize that all of the planning is dependent on how effective our self-isolation measures are. The public has a great opportunity to support everybody, including all of us working inside the healthcare system. We can't flatten the curve. We were dependent on the public to be able to doing that work so that we can be best situated and best set up to meet the needs, because the needs will be less and the needs will be slower. That's my ask of all of you.
Thanks very much, everyone. That's all the time we have for today. Thank you, Premier.
Make
Thank you, Doctor.
a couple of comments in closing here on Derek and Susan's comments with respect to freeing up capacity in our Saskatchewan Health Authority and in our healthcare system, and they've been actively working on just that in foregoing elective surgeries, if you will, and doing everything possible to free up some capacity in our healthcare system so that we're ready for what does come at us. And I want to thank, through Susan Shaw and Derek Miller, or Dr. Shaw and Derek Miller, all of those on your teams and across the Saskatchewan Health Authority for the efforts that have been made in literally the last number of days. The efforts that you've made in sourcing the medical equipment that we will need. And we are having some challenges, yes, in this province, much similar to every other jurisdiction in the world when it comes to ventilators and N95 masks, but we do have the rest of the medical supplies on order or in hand as we find our way into this. So I want to thank all of those in the Saskatchewan Health Authority for the preparation that they have done, and thank them in advance for the effort that I know will be coming. I began today thanking the people of the province for their respect of social distancing and their respect of Dr. Shahab's recommendations, and I just take a moment to thank Dr. Shahab for the many hours a day of work that you were doing on behalf of the people of this province, and the very competent work that you were doing, and the recommendations that you were bringing forth to the government and through yourself to the people of the province. And I don't do this often, but I also would just say a quick thank you to all of the media outlets across Saskatchewan as I talk of the need for clarity in our communities across Saskatchewan, clarity on what the restrictions are, clarity on where to go to access resources that we'll need, we know we'll need in the days and weeks ahead. I do want to thank the media for providing the information to the public in community after community in this province. It is appreciated by me, and it is appreciated by the entire government of Saskatchewan. So thank you very much, everyone.
Thanks very much, everyone.